everyone, my name is Mariam Safar, and today I would like to do a presentation about Empyema. And the reason I chose this topic because last year I have diagnosis with Empyema and end up with a surgery to clear out the infection. So let's get started. So here is the outline of my presentation. I'm going to start with the introduction, symptoms, causes, testing, diagnosis, and treatment. So what I would like to say before starting is that empyema is different than other lung disease, is different than tuberculosis or pleural effusion. It is the accumulation of fluid in the pleural cavity of the lung. As you see here in the first picture, it is a hemothoracic. It is the fluid that will fill fluid with pus will fill up the pleural cavity of the lung and cause the lung to uh, uh, compression, cause compression for the lung, and that gonna cause difficult breathing and so on. So here introduction, it's empyema is a disease that affects lungs. It causes the accumulation of fluid and pus in the pleural cavity of the lung. As I said before, it is affect around 65,000 person in US yearly and with a high mortality rate for older age people. So it also affect younger people, but the mortality rate is low for younger people. So old people tend to have less immune system to fight the infection, so we'll get it like gonna be more dangerous for older people. And the most known cause for empyema is pneumonia, but also there is other causes like there is tuberculosis, there is trauma, lung injury, and so on. Empyema usually it require any cause of lung disease, any any lung disease to require around from 4 to 6 weeks to convert it to empyema. So with rare cases, it's gonna show immediately empyema without anything. That's the reason for that is unknown, as I will explain to that you in a few slides. That's what happened to me. Like I got empyema like in no time. Like I got infection, they thought it's pneumonia, then suddenly it's able to be empyema. So empyema itself is not a contagious disease, but pneumonia does. It does. It is a contagious disease. So empyema can be treated with antibiotics. With most cases, will be recovery and good, so good with antibiotic. But there is a few cases more complicated and need surgery. So as I found here in the article, they said that empyema typically develop from 4 to 6 weeks as soon as the bacteria enter the lung. With my case, that's not what happened. I got empyema within 1 week, got lung infection, and immediately it showed empyema. The symptoms of empyema could be fever, cough, shortness of breath, pain in the chest, pain in the back, fatigue, and weight loss and night sweat. Uh, for my case, the first symptoms I got is coughing, and actually I was coughing, and also I get uh, that mucus with blood. When I cough, I get some mucus with blood and pain in my back. It was very bad pain. Like I have never felt that pain before, and it is the worst pain in my life. Then all these symptoms, it's vary from person to person. Some person experience all these symptoms, some do experience some of them, and so on. The causes of empyema, so actually the main cause, as I said before, it's pneumonia, but with other cases like tuberculosis, lung disease, lung abscess, trauma in the chest that cause affect the lung. So basically anything gonna hurt the lung and cause bacteria to enter the lung, that gonna give chance for empyema to develop in the lung. Testing. As soon as you go to the ER, they will require blood work test to see if there is any evidence about infection in your lung. So they gonna test the white blood cells amount in the blood, and also they gonna test you for the amount of nutritional panel. So if you, for example, got low potassium, low calcium, and so on, that's also indicate as there is an infection going on in your blood, in your body. So they're gonna give you supplement like the vitamin A, vitamin D, sorry, calcium, potassium to help you better fight the infection. And also they're gonna do fluid test, and the fluid test I will go and talk about it more in the next few slides. So they basically what they're gonna start take sample from the nozzle mucus and from the phlegm of the mucus that you spit it out. So they're gonna test to see if there is any kind of evidence about bacterial infection like tuberculosis or MRSA and so on. Diagnosis, after that, after the blood work, they're gonna take you for the X-ray scan. So they're gonna scan your chest and see what's going on. For my case, they did the X-ray and they found like small little dot. And the first day I went to the hospital, they took the X-ray. They found small little dot in my lung. They said it's probably pneumonia. But when I went home after that, I felt the pain is going to be like it's not just pneumonia, there is something going on. I felt there is something more than that. So I went again to the hospital, and the third time I went to the hospital. The third time, the second time I went, also they said pneumonia, and the third time they decided to do the CT scan. So in the CT scan they diagnosed me with empyema. They said it is not pneumonia, it's empyema, and they were surprised because usually with the little infection in the lung, it will require around 4 to 6 weeks, as I said before, to build up to become empyema. But in my case, that was different. I don't know why, and the doctor also didn't know why. So I immediately got from little infection to all my lung built with empyema. Treatment. So the treatment, it depends on the type of empyema. There is two kind of empyema. There is the hospital acquired empyema and there is also the community acquired empyema. The hospital acquired empyema is the most dangerous one because this kind of disease, it's gonna get bacteria that is resistant to antibiotic, like MRSA. That was they found with me. They found MRSA, but I don't know why I didn't work at the hospital or got in contact with someone got infection in the hospital and so on. But they found that I got the MRSA, the resistant bacteria, antibiotic resistant bacteria, and also there is another kind, the community acquired empyema. This is most time is treatable with antibiotic. It's like not very complicated. There's also the same symptoms like fever, cough in the chest, but it's less dangerous than the hospital-acquired empyema. So typically they will give you the erythromycin through the vein, or also or another kind of treatment like beta lactamase, that inhibition combination for bacteria. Um, for me, they started with erythromycin. They thought it's Streptococcus pneumonia because this typically they give it to people with Streptococcus pneumonia. They give them erythromycin, but later, after the surgery, after I did the surgery, they found it's not erythromycin. So that's why I didn't feel well using the antibiotic. Um, so after that, they treat me with vancomycin, which is they will give you the medicine in the vein, and because vancomycin is very strong medicine, very strong on the vein, so they decided to do a big line. So some patients also, like me, will not able to tolerate the strong medicine of vancomycin, so they will do the big line, and the big line is actually gonna do a small incision in your arm here, and thus gonna insert a tube that go immediately to the superior vena cava of the heart. So because this vein is much stronger, it can be able to tolerate the vancomycin, and usually they will give the vancomycin this bottle of vancomycin twice a day, and that will be especially for MRSA to treat the resistant and antibiotic resistant bacteria. The physical treatment for empyema. So as soon as you go to the hospital and they will diagnose you with the empyema, they will decide to drain the fluid from the lung using a small tube. The doctor will insert it through a simple procedure, like it will take about 10 minutes, and then they try to drain out all the fluid or the pus. And when this procedure fail, because sometimes patients will not able to tolerate the medicine they will give you through the tube, they will also, when they insert the tube, they gonna put medicine, they push the medicine uh, to help the fluid to come out. Sometimes patient will not able to tolerate that medicine because very strong medicine. So, and sometimes also there are some cases is the draining will not happen because the mucus and the pus built in the lung is very thick. It will not be easy to drain. So after that, they will decide to do the surgery. As it happened to me, they were able to drain about 2 gallons of fluid in period about 10 days. So in the 9 days, they said it's no more fluid is coming out from my lung. So they said we now have to think about the surgery because you have a lot of infection and we need to do the surgery and not wait, because as we wait, we'll give up, we will give time for bacteria to build up in your lung. So we don't want that. So after that, in the 10 days, we went for the surgery. So there is something doctor will highly recommend it for patient with empyema and pneumonia. It's not just for empyema or any other lung disease. Is they will give you this device, that volumetric device will help you to expand your lung. So you'll take it as this guy you see over here. Take it and inhale and exhale, inhale and exhale for almost 10 times. And also they will give you, this is a small device, I forgot the name, it's VPEP, to like blow in it. So actually that the second one will help to clear up the mucus in the lung, to help to push the mucus and to make the breathe easy, easy breathing. And because the pain of empyema and other like pneumonia or empyema, other like infection, because it is the pain, patient cannot tolerate the pain, they will give you morphine, dilaudid, or oxycodone as a painkiller. So dilaudid is the stronger one. They not gonna give you immediately dilaudid until they see that your pain is more than 10 and scale on 10. So dilaudid like a magic, that when they give you dilaudid, you will feel nothing after about 10 minutes, from that terrible pain to nothing. But what is sad about Dilaudid, it's only gonna last for 2 hours. So after that, they will give you oxycodone. So they do Dilaudid, oxycodone, morphine, Dilaudid, oxycodone, and so on. Uh, Here is the current study about empyema. So now uh, scientists are working hard to understand what is the real cause of empyema and why for some patients it's very hard to diagnose with empyema from the first time. So it's require more time. Empyema will not show in the result, and actually the bacteria MRSA is very tricky bacteria. For my case, they diagnosed me with Streptococcus pneumonia, but when they did the surgery, they found out it's not Streptococcus pneumonia in my lung. They found that the pus contain a lot of MRSA, methicillin-resistant Streptococcus aureus. And so now they, and this study, they trying hard to understand what's the main cause for infection from the beginning. What caused pneumonia, then caused empyema. And what's interesting they found in this study is that most case of infection it caused because the bacteria in the mouth, the normal flora in the mouth, it is the real cause of pneumonia. That was very interesting. So if somebody have poor hygiene with poor mouth hygiene, that's gonna be like in high risk of getting pneumonia in the future. And here is also another study that show here It's that the current state of empyema management, this the name of the study. They saying is that we should not wait too much. If the antibiotic failed to treat the patient, we should think about the procedure of surgery, because the time they wait, it will give more chance for infection to build up in the lung and make it more complicated to treat. So they will think about, don't wait. As they told me in the hospital, and I was okay, I'm agree with that. Let's do the surgery, because as soon as you did the surgery, you will get much better result after the surgery. Here is the medical terminology terms of my presentations, and here is the works cited. And thank you for your watching. If there is any question, just please comment below. I will happy to answer your questions. Thank you.